When you consider studying medicine, you see yourself walking through the hospital wearing a white doctor's coat, maybe with a small resemblance to Dr. House or one of the Grey's Anatomy doctors. Obviously, you know that it will take a lot of hard work and many hours of studying to accomplish this goal. But studying is only one part of the job. There is so much more to it. And what could that be? You ask yourself. Well, imagine that you have a painful arm and you decide to visit a doctor. You would highly appreciate it if the doctor is on time and takes your story seriously. You expect him or her to listen carefully and to give you advice that is actually helpful. Therefore, it is important that a doctor, or any other healthcare professional, is not only knowledgeable, but also possesses the right attitude and the skills. The combination of these three qualities is what we call a competency. And the best way to develop these competencies is to learn by doing. Most medical professions require the same competencies, which is also called a competency model. In the Netherlands, the CanMeds model is frequently used in medical education. It is based on 7 competencies, which are translated into 7 physician roles. As a medical student, it is relevant to know which roles you need to train and what they exactly entail. But it is also important to know that competencies interact. Now, are you with us so far? Let's explain with a practical example. A pregnant lady steps into your office for an appointment. She complains about having frequent and severe headaches. During your consultation as a doctor, you find out that she is a heavy smoker. In your role as health advocate, you want her to quit smoking, as this is very harmful for her and even more for her unborn child. But how do you go about this issue? How do you convince a patient with an addiction to quit smoking immediately? And imagine that your patient is from another country, where smoking during pregnancy is commonly accepted. To handle this correctly, you need to be a good communicator, and you need to remain professional at all times. You will need to provide scientific evidence to substantiate your advice. That is where your role as scholar comes in handy. It will help you to understand the complex research articles and to translate them into information that is comprehensible for your patient. To offer your patient optimal care, you will collaborate with other healthcare professionals. You will adopt a leader role because you are the person ultimately responsible for the treatment of your patient. When you possess enough practical medical knowledge and are able to switch seamlessly between these competencies as a doctor, you are allowed to call yourself a medical expert. But becoming a medical expert depends also on the time and environment you are currently in. Only 50 years ago, we did not have access to the internet, so there was no other choice than trusting your doctor's expertise and advice. These days, patients will first inform themselves by searching the internet before visiting a doctor. Did you know that all the scientific knowledge we have obtained between the year 0 and 2014 has actually doubled between the summer of 2016 and the summer of 2017? It is only reasonable that we cannot memorize all the knowledge that's out there. But as a doctor, you need to be able to filter all of this knowledge. Also, our mobility has increased rapidly in the last few years, not only digitally, but also physically. Borders between countries are fading. We will be treating diseases from other countries, and we will also be treating patients from other countries and different cultures. Remember, doctors as solo practitioners have completely disappeared in the past 10 years. All medical professionals function in teams, from primary healthcare to academic hospitals. Therefore, teamwork is the most important issue addressed in the medical education. Healthcare demands will continue to constantly change. It is up to you, as a future medical professional, to learn to handle this. Therefore, it is important to realize that your competency development never stops. Competencies are not learning objectives that you have to meet at the end of your course. After your bachelor's degree, there is not only your master's, but there's also a career path. During your career, you will still be learning every day. So remember, it is all about personal growth. Well, that was a lot of information. Let's do a quick recap. Mastering the competencies of the CanMeds model is crucial in becoming a competent doctor. Especially in this world, where information is abundant and mobility keeps increasing. So don't hide behind your pile of books, but get practical. This way, you will definitely become the doctor of the future.